everyone, this is Megan Darling. I'm a student nurse at the University of Buffalo, and I'm going to talk a little bit about my philosophy of nursing. In this presentation, I'll discuss my personal philosophy, my current plan for the near future, some theories that fit my aspirations, nursing as a practice and discipline, contemporary issues affecting the field, and how I hope my patients will describe me. After I graduate and move back to New Jersey, I would like to get a job in a general hospital so that I can get a wide variety of experiences and see as much as I can. I would then like to work in either a psych ward or an institution. After a few years, I'll consider going back to school to become a nurse practitioner. I don't think it's too smart to go straight into an NP program without having worked as a nurse first and gaining first-hand experiences. All of us will be in the promise phase, as Shirey describes. We'll be fairly naive in our practice, and we'll just be trying to suck up as much experience as possible. To me, nursing is both an art and a science. I want to do my best to meet every need of my patient, whether it be physiological, psychological, cultural, emotional, and so on. Being an advocate for the patient and speaking up for them when they can't is a vital part of nursing. I think that's one reason psychiatric nursing appeals to me so much, and it seems like a very specialized area that not too many students hold an interest in. I feel that caring for the family is just as important as caring for the patient. Many times they are just as fearful as the unknown as the patient is, so taking their emotions and needs into consideration is important too. I could see myself potentially joining the American Psychiatric Nurses Association. Their fees for a student and even for an RN are low compared to other groups such as the American Nurses Association. There are numerous resources for continuing education and collaboration specific for the mental health community. I also like how not only RNs are in the community. Anyone who is in the mental health field can become members, so there are resources, opinions, and information coming from a wide variety of backgrounds. One of the theories I liked researching this semester was Gene Watson's theory of human caring. According to our Taylor textbook, the central theme is nursing is concerned with promoting and restoring health, preventing illness, and caring for the sick. In terms of applying the theory to clinical practice, clinical nursing care is holistic to promote humanism, health, and quality of living. Caring is universal and is practiced through interpersonal relationships. A caring environment is one that offers the resources to develop the person to their full potential while still allowing them their individual autonomy. Another theory I'll try to employ in my practice is Dorothy Orn's SelfCare Theory. Our Taylor book describes the central theme by stating self-care is a human need and self-care deficits require nursing actions. In terms of applying this theory to clinical practice, nursing is a human service, and nurses design interventions to provide or to manage self-care actions for sustaining health or recovering from an illness or injury. People are distinct individuals who should be self-reliant and responsible for their own care, and it's our duty as nurses to help them get to the point of self-care and independence. In my opinion, nursing is not either a practice or a discipline, it's both. As a practice, we must utilize ADPI, assess, diagnose, plan, implement, and evaluate. We have to use the critical thinking skills we are learning to develop in order to provide care that is individualized and holistic. We must, within our scope, promote health, prevent illness, and restore health. In terms of nursing as a discipline, we have to utilize all of the continuing education resources available to us. An educated nurse is a competent nurse, and keeping ourselves up to date with the ever-changing medications and techniques is imperative. We have to focus our nursing interventions on the most current evidence-based practices. Now let's talk about a few contemporary issues in the field of nursing. The first one being horizontal violence. The profession of nursing is somewhat notorious for what some call eating their young. Examples of lateral nurse-to-nurse violence include being uncivil and rude, setting someone up for failure, taking someone's ideas, or embarrassing someone. I hope that I work in an establishment that does not allow behavior like this, and I hope my work environment will be supportive, collaborative, and mature. I think it's extremely important that good nurses step up as mentors and show new nurses the ropes. Another contemporary issue is the vast nursing shortage. The ANA conducted a study in 2011 of 220,000 nurses in 13,000 nursing units across America. 54% of nurses in adult medical units and emergency rooms felt that they didn't have enough sufficient time with patients due to staffing shortages. I was a CNA at Elderwood for a year, and on a well-staffed night, each nurse had at least 20 patients because there was such an issue with staffing. The nurses there had zero time to spend with their patients, and they were all burnt out beyond belief. I hope to work at a facility where there is a reasonable patient-to-nurse ratio, because I would like to spend time with my patients and care for them without feeling like I need to rush to get to the next patient. The final contemporary issue I will discuss with you is the aging population. The older adult population is expanding more rapidly than any other age group, with the greatest increase in those older than 75 years of age. This requires teaching and nursing interventions designed to meet needs that are different from those of younger patients. Nurses will be in high demand as older people with more and more chronic conditions will need medical assistance. Now that people are living much longer, gerontology would be a very smart and practical specialization for a nurse. When I become a nurse, I hope that my patients will describe me as compassionate, knowledgeable, helpful, approachable, and trustworthy. I hope to utilize my sense of humor to put my patients at ease and let them know that I will do my absolute best to help them with any issue they have. Here are the links to all the pictures I used in this presentation, and here are my references. Thanks so much for watching. Have a great day.